Are we ready?
Yep.
All right. So position patient. Request the patient to be seated in the chair. Adjust the headrest to comfortable position. Adjust the patient's lower legs parallel to the floor.
Let me know how this feels on your head here.
All right.
Is that better?
Yeah, that's better. That's adjusting the headrest. And now she's going to position the patient's lower legs parallel to the floor. Position patient in near supine position. Reposition patient's head if needed.
How do you feel?
That's good. Operator position. Center body weight on the operator's chair. Keep feet flat on the floor. Thighs parallel to the floor. Back straight. Keep head and neck in the same plane as torso. Keep a minimum of 14 to 16 inches between the operator's eyes and patient's mouth. Keep elbows in close proximity to the torso. Maintain working field at height relaxed elbows. Now we're going to position the patient for the maxilla. Patient's head and hips should be in the same plane. And the dental light positioned over the patient's hips. So the maxilla, we have the patient's head and hips in the same plane and the leg over the hips. For the mandible, patient's head and knees in the same plane. Back. And dental light positioned over the patient's head. Now we're going to demonstrate positionings for surfaces towards and away. So, Amber, right now, what clock position are you in? You're at 8 o'clock right now. So can you show me 8? Can you show me 9? 10? 11? 12? 1? 2? And 3. And Amber's gonna come back to 8 o'clock position because she's right-handed. If you look in your pack book, we do have surface towards and away for left and right-handers. So right now, Amber's in 8 to 10 o'clock. She's going to the anterior surfaces towards the operator. So at this point, she's going to be working on the maxilla. And she's going to point to the anterior teeth and towards her. So that would be on the patient's right side, that would be distal. That's where we want to go. So towards you would be distal. But on that side towards you would be mesial, and mesial. And then surfaces away would be 11 to 1 o'clock. Anterior surfaces away. On the patient's right side, that would be mesial. And on the left side, it would be distal. Yep, posterior. She's gonna sit at 10 or 11. Posterior surfaces away from the clinician.
Okay.
So show the way would be buccal. And on the right side, away would be lingual. And on the mandible, it would be buccal and lingual. And then 9 o'clock, posterior surfaces towards. Got buccal and lingual on the maxilla. And then buccal